Hi everyone, I'm Rami Benson and I'm a senior in West Liberty's Medical Laboratory Science program, and I'm going to show you what it's like to be in my major for a day. Now we're going to head back to my blood bank station. So in blood bank, we are working with blood products for patients. So if a patient comes in and needs a transfusion, they can get blood products from here, and we do all the typing and screening and making sure that the products are safe for transfusion. So what I'm doing right now is I'm working on some QC. These are all of my reagents, and this is how we do blood typing, looking for antibodies and antigens that might be in the patient's blood. And right now I'm working on QC, which is done every morning to make sure that all of our reagents are working correctly and that we can detect anything that might cause a problem. So the Medical Laboratory Science program at West Liberty is set up in a 2-in-2 instructional. And so the first 2 years you're doing just your gen eds, so you get all of your general studies done those first 2 years, and then the prerequisites for your Medical Laboratory Science program. So that would be things like anatomy, your general biology. Your senior year, the fall semester, you go to clinicals, which is when you are strictly in the hospital for all 16 weeks of the semester. And then the spring semester of senior year is review for your boards, which happen after graduation. I'm doing my clinical work at OVMC. I have done my hematology and blood banking rotations here. Every senior in the Medical Laboratory Science program is required to go through the clinical rotations. We generally do them at OVMC, Wheeling Hospital, Weirton Medical Center, East Ohio Regional Hospital, and several other medical institutions. I am looking to make sure that my reagents are reacting well with my control cells, and I'm just making sure that the antibody in my QC kit is being picked up by my reagents. So when I'm actually testing patients, that I can be confident that if there is actually an antigen present, that my reagent will pick it up. In my blood banking, I've been doing a lot of practicing. Sometimes my supervisor will give me some things that are a little unexpected, that are a little challenging for me to figure out. So she'll give me, some antibody that's a little bit harder to find just for practicing reasons. And it's really great to have all the experiences actually seeing the workflow and being able to work side by side with people who have been working for years and getting to hear about their experiences and any tips and tricks they have for someone just starting out. Okay, so now I'm going to be taking my screening cells out and I'm going to put them to centrifuge. They've been incubating for 15 minutes, and that is just to strengthen their reaction, and it's making sure that these cards that we use for our testing are working and to make sure that our reagents are working. So rotations are able to follow around a tech that is actually working, and you're able to see how they do things and the kind of specimens that they receive and how they process them. And then towards the end of your rotation, you'll have the techs, you're still with the tech, but they will allow you to do some of the testing under supervision, and that way you get actual on-the-job experience. So we have 4+ reactions, so our screenings work. So during blood banking, you're either really busy or you're really not. And so during those few downtimes, I'm able to study for my boards. I'm able to review the procedures and the actual science behind what I'm doing, which is really awesome. It's just a reminder of the structures of the red blood cells and really the importance of the science and the reactions that I'm looking at and what they can mean for the patient, and just the information that they provide to the doctors. So now I'm going to grab some blood to do some typing. So I'm just going to grab a tube here, and I'm going to make sure that I can see where my blood is that I'm working with. So first thing I'm going to do is I'm going to label my tubes, and I have to make a 3% cell suspension and then a 0.8 cell suspension first. Now I'm just going to grab some packed red blood cells. I am planning on, obviously taking my boards once I graduate, and then I'm planning to move back home to Columbus. But right now I'm considering going on to school to be a pathology assistant. A pathology assistant is someone who helps a pathologist determine, they prep specimens, and they help them out with that diagnosis. The job outlook for medical laboratory science is incredible. There's so many job opportunities, so many hospitals are really hurting for MLSs and need a lot of help in the lab. It's a really secure job, lots of people are needed, and you can go on to do things like, pathology assistant if you want. And so it's a really good degree to have that you can grow a lot with too. Okay. And they're negative for that as well. So for their forward typing as an O negative. So then I'm just going to check my reverse cells to make sure that they reverse type as an O negative as well. So that's a positive reaction, that one solid agglutinate, so they do have an anti-A in their serum. And then the same thing with B. They have that one large agglutinate again, so that's a positive, so they also have an anti-B, so they are reverse typing as an O negative as well. I hope this gave you a good look of what it's like to be in the Medical Laboratory Science program at West Liberty. For more information, visit our website.